We're good, sir.
Very good. Okay, let's call the Public Works and Utilities Committee meeting for Tuesday, May 26th to order. Can we have a roll call, please, Ms. Martin?
Yes, sir. Councilor Christopher Rivera,
Here.
Councilor Romano Beta,
Here.
Councilor Sidney Lindell,
Here.
Councilor Joanne Vigil Koppler,
Here.
Councilor Michael Garcia.
Here.
You have a quorum, Mr. Chair.
Thank you. So I only have 9 people on my screen. So if any counselors have something to say or something to ask, just begin to speak, and I think you'll appear as the main speaker, but just get my attention. If not, the more button with the 3 toggles has a raise hand feature. So you can raise your hand there and ask any questions and get my attention that way. So we're on to item 3, approval of the agenda. Any changes from staff? Start with Mr. Romero.
No changes, Mr. Chair.
I believe Ms. Pisula had something.
Yes, Mr. Chair. I received an email this afternoon regarding item D. We had forgotten to attach Exhibit 2. So in the document, it refers to Exhibit 2. So I sent it to all of you. If you have not received it, just let me know.
So it's sent by email?
Yes, sir.
Okay. All right. Any changes from Mr. Jones?
There are no changes from us, Chair. Thank you.
All right, Jamie, anything from you?
There are no changes.
All right, what are the wishes of the committee?
Move for approval.
Second.
We have a motion for approval from Councilor Beta, a second from Councilor Vigil Koppler on approval of the agenda. Can we have a roll call, please, Ms. Martin?
Yes, sir. Councilor Romano Beta,
Yes.
Councilor Sidney Lindell,
Yes.
Councilor Joanne Vigil Koppler,
Yes.
Councilor Michael Garcia,
Yes.
Councilor Christopher Rivera.
Yes,
Motion passes.
thank you. Approval of the consent agenda. Any changes from Mr. Romero?
No changes, Mr. Chair.
Any changes from Mr. Jones?
There are none, Chair.
All right, anything the committee members would like to pull off? Let's start with Councilor Beta.
I have nothing, Mr. Chair. Thank you.
All right, Councilor Lindell.
Chair, I do want to pull item 7D about the Garson, and I was looking for clarification that I texted to you earlier on item 7C.
Yeah, I think it'd probably be best to pull it.
Okay, I'll pull 7C and 7D.
Thank you. Councilor or Councilwoman Vigil Koppler
Yes, I'd like to remove item A.
and Councilor Garcia.
None at the moment, Mr. Chair.
All right, so at the moment we have items A, C, and D. D as in David, pooled for further clarification. Any further discussion? All right, what are the wishes of the committee?
Move for approval as amended.
Second.
Motion for approval is amended by Councilor Beta, second by Councilor Vigil Koppler. We have a roll call vote, please, Ms. Martin.
Yes, sir. Councilor Romano Beta,
Yes.
Councilor Sidney Lindell,
Yes.
Councilor Joanne Vigil Koppler,
Yes.
Councilor Michael Garcia,
Yes.
Chairman Christopher Rivera.
Yes.
Motion passes.
Thank you. Next, approval of the minutes from May 11th, Public Works and Utilities Committee meeting. Any changes from Mr. Romero?
No, Mr. Chair.
Anything from Mr. Jones?
No, Mr. Chair.
All right, any changes from the committee? Wishes of the committee?
Move to approve.
Second.
A motion for for approval from Counselor Lindell and a second from Counselor Vihel Coppler. Any further discussion? Seeing none, all those, oh, sorry. Roll call vote, Ms. Martin?
Yes. Counselor Amana Beta,
Yes.
Counselor Signa Lindell,
Yes,
Counselor Joanne Vihel Coppler,
Yes,
Counselor Michael Garcia,
Yes.
Chairman Christopher Rivera.
Yes.
Motion passes.
All right, public comment, anything from Ms. Pasula?
No, Mr. Chair.
Anything from Ms. Ray Diaz?
No, Mr. Chair.
All right, public comment is closed. We're on to the consent agenda. Item A, request for approval of amendment number 8 to service contract 18-0552 in the total amount of 974,000 plus applicable NMRGT for annual security services. Councilor Vihel Coppler, you pull this.
thank you, Mr. Chair. I wanted to just explore the idea of some of these charges in light of the situation as we see it today. I was wondering if there was any room for cutting back on some of these amounts. There is language in here somewhere. I thought I had it, but anyway, for example, for Hannah Viva Chavez, there's an amount and it says for like, I don't know if it was 100 hours or I don't know what, for covering events and stuff like that. I'm sure there are other areas as well, but you know, it's looking like we're really not going to have a lot of events and not much to patrol except for the building itself, and not necessarily have security inside the buildings. I understand maybe not even half a year, but it looks pretty grim. So I'm concerned about the amount of hours and the description of what's to be done, especially because apparently this security system was intending on either patrolling or even doing some inside work on events and such. And as I know it today, we're not having a lot of events. So maybe I'm wrong. So Mr. Burnett, maybe you could address that?
Absolutely. Mr. Chair, Councilor Vihel Coppler, the way the contract is set up is essentially for security in a perfect world. If the COVID situation hadn't interrupted business as usual at the city. Allied Security can and will adjust the amount of hours they work at any facility based on needs. So even today, in the contract, the 2019 through 2020 contract, we've been able to adjust the amount of security we've used at any facility, and Allied only bills us for the number of security hours provided. So the contract really just covers us for business as usual. And then as we move into the next fiscal year, as operations in the city change, we'll be able to work with the manager of Allied Security to adjust the levels they're providing us, and they will bill us accordingly. And I wonder, does that answer the question?
Well, yeah, has that been the case where they've only billed for the hours and maybe it's come in less?
Absolutely. I manage the portion of the contract for Midtown Campus, and we have done that here. We have both increased and decreased the amount of security provided here, and they've billed accordingly. I've worked with Maria Tucker at the library. We've reduced the amount of security currently provided there, and they've adjusted their billing accordingly. I'm trying to think of, I believe there's another location. I believe the Santa Fe Trails location has also reduced their hours, and they've billed accordingly. So they have been very flexible in working with us. They document their hours. They only bill us for the hours they've worked. I've spoken both with their contract manager and the City of Santa Fe security manager about the COVID crisis and the likely implications to our contract with them. And they understand the situation we're in and are ready and willing to work with us. I do understand the confusion. It took a while to clarify all the details in building this contract amendment. And I thought it made a lot of sense to continue forward with, kind of, I don't know how to refer to it, best case scenario, business as usual, and then just have Allied bill us for the hours they actually spend rather than trying to reforge a contract for an unknown future landscape. And so we ended up in this position, but very clearly they're willing to work with us. They have done so in the past, and I completely trust their ability to do that.
Okay, then I trust you. All right.
Thank you very much.
No more, Mr. Chair.
Thank you. Any other questions? I can see Councilor Lindell. I can't see Councilor Garcia or Councilor Abeta. So do you have any other questions?
No, Mr. Chair. No, Mr. Chair.
Okay. I do have one. Mr. Burnett, are we flexible enough in this contract that with $100 million budget, if we had to shut down a recreational facility that we can, I don't think that security services, they'd probably need to be upgraded in those situations. Do we have the flexibility to have potentially upgraded security services to any of those facilities?
Yes, Mr. Chair, in this contract, we include a $25,000 contingency. So if it fit within inside of that, absolutely. If we had to do any major changes that took us beyond an additional $25,000, I would have to process another contract amendment.
Right. Okay. That was my only question. So what are the wishes of the committee?
I move to approve.
Second,
A motion for approval from Councilor Vihil Coppler, a second from Councilor Lindell. Any further discussion? All right, can we have a roll call vote, Ms. Martin? You're on mute, Ms. Martin.
Yes, sorry. Counselor
There you go.
Romano,
Yes.
Counselor Signe Lindell,
yes,
Counselor Joanne Vihil Coppler,
Yes?
Counselor Michael Garcia,
Yes.
Chairman Christopher Rivera.
Yes,
Motion passes.
thank you. On item C, request for approval of the Santa Fe Rail Yard Community Corporation's proposed amendment number 9 to the amended and restated lease and management agreement. Councilor Lindell, you pull this.
thank you, Chair. Just a quick question on this. I saw a couple of different proposals. One as recent as May 18th from SFRCC. However, what we are being asked here is not the consideration of that proposal nor their previous proposal. What we are being asked here is to pass and to approve the amendment suggested by city staff. Is that true?
Mr. Chair and Councilor Lindell, this is Rich Brown. Yes, that is true.
That's all I have, Chair. With that, I'll make a motion to approve.
Second.
All right, we have a motion for approval by Councilor Lindell and a second by, I think it was Councilor Garcia.
Counselor Abeta, I think. Was it Counselor Abeta?
Yes.
Yes.
Councilor Beta, okay. Thank you. Any further discussion? All right, seeing none, can we have a roll call vote, Ms. Martin?
Yes, so Counselor Romano Beta,
Yes.
Counselor Signe Lindell,
Yes,
Counselor Genevieve Coppler,
Yes,
Counselor Michael Garcia,
Yes.
Chairman Christopher Rivera.
Yes.
Motion passes.
Thank you. Next, item D, request for approval of amendment number 1 to the Garson Studios lease agreement, item number 19-0341. That's all I'll read on that. Counselor Lindell, you pull this one.
thank you, Chair. Yeah, I'm on page 9 of the packet, 9 of 35. And I'm looking at the revised base rent, and I'm just curious, actually, it's item 4, operational expenses. I'm just curious what those operational expenses run on a monthly or an annual basis, because it looks like the city is responsible for all the utilities and a lot of other, a lot of other fees, all the way down to furnishings and equipment. So I'm not sure, is it you, Rick, Mr. Brown, that needs to comment on this?
Mr. Chair, Council Lindell, I was hoping that Sam Burnett was still on the line, but maybe Andrea Salazar, our assistant city attorney, may be able to answer that question. But it looks like Sam has taken off. He manages the Midtown campus and operations. I don't know.
Chair, Councilor Lindell, I am not certain as to what those costs tally. Sam would be the right person to for that question. I apologize.
Well, I called this question in earlier, hoping I could get an answer on it. I'm not going to be able to support this without knowing, if we have $60,000 in rent that we get, but if we have $30,000 a month in expenses, I don't have any idea what our real true stream of income is off from this. Maybe someone else has some comments or.
Mr. Chair, Councilor Lindell, I'm gonna see if I can ping Sam to have him see if he can come back on. I think we do make a profit, but I want to have Sam explain how the income stream works. Oh, looks like Regina might be.
Are there any other questions?
Yeah, just, if I could add on, to Councilor Lindell's question, the reason why we're adding this amendment to this agreement is that we have a nationally known cable TV production company that wants to rent the campus, and they want to expand their footprint of rent by almost 3x. So our operations charges aren't going to change, but if this production company comes in, we could see almost a 3x amount of income. Surely it's going to pay our expenses, but I think Sam could explain what the current. Oh, here he just jumped back.
Well, let me ask a question on that. I'm not exactly sure how that works. If a tenant comes in that way, I thought that we were subleasing that to someone else and our rent would remain the same, and whomever we're subleasing it to might get 3 times the rent. But I don't think that the way that I read this, that we would get 3 times the rent.
Mr. Chair, Councilor Lindell, there'll be additional buildings for rental that have not been monetized. So that's where the additional rental income comes in. So currently, we're looking at the stage sets or the different stages, but there are 2 or 3 more buildings that they would like to rent that will bring in additional income, which have never been buildings that we've rented before. So it's new rental income.
But that isn't broken out and included in this contract, is it?
It's not, because we, Councilor Lindell, we have not, the subleaser, Garson Studios, has not finalized their license agreement with this cable company. And so they can't really move forward until we allow them this ability to rent these additional spaces.
Sorry, maybe, Chair, Councilor Lindell, maybe I can explain. The lease and the agreement itself gives Garson the ability to license out the ground. So we're talking about the entire footprint of the campus itself. That's what's always been part of their lease agreement, with the right to license it out. So previously in the lease agreement, we had a base rent fee that accounted for all the studios and stages. And because one of those stages is necessary for the master developers that were selected, they would like to start utilizing that. We have carved that out. So we have augmented the base rent of what their footprint is, but they have the right to license out the remainder of the grounds according to the market rate, fair market rate value rentals. So that does come to us. So it's not memorialized in terms of this is each piece of property in the agreement, but it's an attachment to the agreement. And so that is what is paid if they use another building.
I appreciate that. I'm just trying to find out what we're renting and how much rent we're going to get for it and what the term is. And I'm concerned about our agreement in terms of what we have agreed to pay as far as operational expenses. I see that there is some cap on those of $10,000 a month, but it's only that approval would be needed if it's over $10,000 a month. I don't know who gives that approval either.
Mr. Burnett is also on or back on, so I don't know if he can add to that. Sam?
Yeah, absolutely. I know, and the specific dollar amount I would defer to Rich on, but in the case of Garson Studios, any work they were to do on campus, there is a dollar amount, a threshold at which they would need the authorization of Mr. Brown or this Midtown Steering Committee to approve that work. And I believe that dollar amount is fairly low.
I'm seeing $10,000 in this.
I do not have the dollar figure, so I can't speak to that, but that seems exceptionally high to me. My guess would be somewhere between like $1,000 and $2,500 would be the cap on a tenant's discretionary spending that would be deducted from their rent.
Well, I think we don't know is what I think, and that we need to know. I can't approve a contract that I really don't know what I'm approving. I'm not sure where the approval on that, it doesn't say who the approval needs to come from. I doubt that it's from the Midtown
Steering committee.
Selection committee. I don't think that that's been vested in, to that committee. I don't know if it's Mr. Brown. I don't know if it's the city manager or the city attorney. I just think that we're being asked to approve things that we don't really know what we're approving here. And that bothers me. This needs some clarity to it, and maybe it needs an executive summary to it also. So those are my thoughts, Chair.
Okay.
Thank you, Councilor. Can anybody clarify for Councilor Lindell her concerns?
Yeah, Mr. Chair, Councilor Lindell, I know that I don't make the operational approval, and I don't think the steering committee does either. I think it still has to go through the city manager and in the city manager's current signing approval, but it will ultimately have to come to the city council for approval, so that there's some transparency and or accountability actually in what's being done. And
Mr. Brown, I've never seen one of those come to us before.
well, that.
I mean, and I have to believe that there have been projects that have been completed on that campus by the Garson Studio lessee.
Correct. And Mr. Chair, Councilor Liddell, are you suggesting that we amend amend this amendment so that there is a clarity around approval of additional operational cost or approval for rentals?
Well, that's just one thing. I think that there's really a lack of clarity of what we are renting this property for and what we're responsible for with it and what those costs have been in the past and who has the authority over it. I think that there's a real lack of clarity in this contract.
Well, Mr. Brown or Mr. Burnett, are there any time constraints with this?
Mr. Chair,
approval?
Yeah, Mr. Chair, Councilor Rivera, there is a time constraint, as in we have as I said, a global TV cable company that wants to lease the space, but the Garson Studios principal does not have the authority to go into a license agreement with that studio, which is worth about $110 million a year in GRT, or actually revenue per year, without this amendment to the lease. And I appreciate Councilor Lindell's questions that I want to get answers for.
When does this go to the governing body?
It's coming, I think we're on tomorrow for the governing body, so we can get changes done tonight or early morning to get out to the governing body, at least based upon.
Are you able to have Councilor Lindell's questions answered by tomorrow night?
Mr. Chair, Councilor Lindell, I'm hoping to. I need to sit down with Sam and the legal counsel and maybe with the other public works folks who've been working on the Midtown campus. Looks like Regina Wheeler has a statement she wants to make.
Yeah, thank you, Chair. Councilor Lindell, members of the committee. I think if I understand Councilor Lindell's original question, there were some pieces that I could help clarify. The utilities for all the facilities at Midtown are not broken out. We don't have separate meters on every building. So we don't have the ability at this point to bill separately for all the utilities for all the renters, but we are looking at the possibility of making some improvements in that way. So I think that's one thing. We actually have been managing this lease for a number of years now, the whole time that I've been here. And we do have a really clear process for managing it. So the renters, the lessees speak to Sam about the issues that they want done. If they're small, like he said, sub $1,000, then he works it out with them. If they're bigger, they come through the steering committee, and Councilor Lindell for the Midtown property that we've had in place for some time now. And Councilor Lindell might remember that there was actually a big project that came through that steering committee, and that was for paving the parking lot. And that was a couple $100,000 project, and we did seek steering committee approval on that. So we do have a really well-defined process where we use, and in fact, there's a subcommittee to the Midtown Steering Committee, which is the Midtown Infrastructure Committee that used to meet on a every other week from the steering committee, and then we reviewed all of the issues that were arising. So anything that's over like $1,000 comes above above and outside the lessees. We discuss it in our infrastructure subcommittee, and then we bring it to the state large. And so for the most part, there haven't been a lot of things that came forward, but there was the one for the paving of the parking lot. Mm-hmm. I think the other important thing to note is that it's not just the rent payments that we get from this lessee, actually. I believe there's other revenue streams associated with their utilization of additional properties, with their successful signing of contracts with companies to use the property for film production. And so it's been quite I think, a significant revenue generator. I don't know, Rich, if we have the total number of revenue that we got from the Garson Studios last year, but I think that might be a helpful number to have to sort of help weigh some of the expenses that we do absorb associated with this agreement. But it's a really, really important piece, and you guys must know that it's incredibly central right now to the Midtown redevelopment conversation, which is why Rich said that this is extremely time sensitive. The redevelopment team and the pressure from the film industry to expand their operations in Santa Fe is significant, and they want to move quickly. They're talking about deploying in August and being on site and starting, and that generates more and more revenue for us. So it's really important.
You know, Ms. Wheeler, I appreciate all of that, but I just don't think that we should approve contracts that aren't clear. And this contract doesn't appear to have clarity to me. I agree with everything you say. It's a contract that we need to pursue. We need to make it work, but we need clarity of the contract so that we know what we're getting and what we're giving. And who controls that and who looks at it and who pays attention to it. That's my point with this. It's not that it's not a good project. I know it's a good project, but I see things in the contract. You know, I'm on lease page 6, operational expenses. Those are pretty broad and we're on the hook for them. And maybe in the past they haven't been too much. I couldn't begin to guess what the utilities for this area of the campus cost us, although not much else on the campus is running, so we probably will have some idea what they're costing us. I'm not trying to be obstructionist about this. I'm just trying to make sure that all our bases are covered and we don't have any surprises, and that we're not committed to pay for things that we don't want to pay for. Or that
Thank you. Mr. Burnett has something to add, I believe.
Mr. Chair, Councilor Lindell, what I'm thinking is a couple things. First and foremost, I just completed some work on the Garson Studios to add electric submetering and gas submetering, which can help us clarify utility usage in those buildings. So that's something we could incorporate into a contract. Another thing that I would like to recommend to Mr. Brown and to the counselors here is to develop kind of a benchmark for what the council feels comfortable with in terms of a limit for the limit that the Garson Studios can spend on any improvements or repairs, and include that in the contract and bring that back to the governing body as a way to keep the contract moving, because it is time sensitive, address your issues and to keep the contract moving.
Again, Sam, this is supposed to go to council tomorrow night, so that's a lot of work to try to get done in 24 hours. Is that something you can do? Is that what you're suggesting?
I would be happy to help with that, but I do not write the lease agreements, so I hesitate to speak for economic development.
Mr. Chair, it may be impossible for us because we still have to go back to the lessee and revise these terms, and then maybe have to go back to the developer who is working on Studio C, so that we can look at the terms and then agree upon them and then have a re-signature, because this document was signed by the parties involved over a 3-week time period.
So this does have time constraints, but can it wait till the next governing body meeting? Not the one tomorrow, but the one after that? Or does it need to be decided tomorrow.
Mr. Chair, our preference is to have it signed tomorrow because the film production industry is very fickle. And so I don't know in these times what their response will be. But I recognize that there's some data that needs to come forward. So I don't have a distinct answer to today, but my preference would be to send it to council tomorrow, and then I will put the city attorney's office to see how much we can revise it, and then get all the other parties who are signatories to see if they're agreeable to any changes we need to make.
So can you have Councillor Lindell's concerns answered by tomorrow?
Mr. Chair, I can't guarantee all of her concerns are answered, but I'm going to make the attempt to get all the parties involved, because if we change the amendment, I have to go through the cycle of the signatories that were there, and I will need to get through their channels and write up the changes and make sure that we have it clear.
Understand. So as a committee, we have the duty either to disapprove, to approve, or we can move on without a recommendation. So it's up to this committee, whatever you decide. So I don't know if we're ready for a motion yet, but if there's any other discussion, please chime in now. I can see Councillor Vihel Coppler.
You know, I don't have a problem with this contract, and the city staff has worked on it, and I think we have less to gain and more to lose, and I don't want to get behind schedule. And I'm fairly fine with moving it forward, and so I'll go out and make a motion to approve. See what happens.
We have a motion for approval. Do we have a second?
I'll second it, Chair.
Motion for approval from Councillor Vihel Coppler, a second from Councillor Garcia. Any further discussion? All right, let's take a roll call vote, Ms. Martin.
Councillor Romana Beta,
Yes.
Councillor Sig,
I'll abstain.
Councillor Joanne Vihel Coppler,
Yes,
Councillor Michael Garcia,
Yes.
Chair Christopher Rivera.
Yes.
Motion passes.
Thank you, Ms. Martin. I would still, even though it passed, try to make sure if we can get those questions answered that Councillor Lindell had, that we try to do that by tomorrow night.
Yes, Mr. Chair, Sam and I have been chatting. We're going to work on it in the morning to get out to Councilor Lindell before the evening.
Great. Thank you.
Thank you.
Next, we're on item 8, discussion regarding employee health and life insurance benefits presented by Aon. Ms. Salazar, you're on. I don't know if anyone from Aon's on, but why don't we start with you, Ms. Salazar?
Costing analysis. An updated presentation was submitted and sent out today. This is one of many difficult decisions that will need to be made in the next several weeks. And we're doing our best to make appropriate changes to this. And being aware of how changes will impact our employees as well as.
Mr. Chairman, I can't hear her.
Can you hear me now?
Yes.
Yeah, Ms. Salazar, you keep cutting in and out, so we catch like 4 words and then you disappear for a little bit.
So I was giving a precursor to the presentation that Aon will be presenting. So I can go over it again if you didn't get it all.
I don't think we got it all, so if you can start again, that would be great.
Okay. So as we continue to discuss changes with union leadership regarding our benefits plan and provide more costing analysis, an updated presentation was sent out earlier today. And this is one of many difficult decisions that will need to be made in the next several weeks in an effort to help balance our budget to determine how these changes will impact our employees and to continue to protect our city services. And so we, again, continue to look at different options, do some different costing, work with our union leadership, and therefore we have the updated options that Aon will now go over.
Ms. Salazar, before we move on, I know it appears that this is tied to COVID-19 and probably the furloughs that we're doing and everything else, but in reality, had COVID-19 never happened, we're still in this situation, right?
Mr. Chairman, yes, you're absolutely correct. This has been an issue that the city has had with our self-insured plan for the last, it comes and goes in waves, but the last couple of years have been especially difficult with regard to claims and revenues coming in.
Yeah, and I was on the finance committee meeting last week where many of the unions got on and they had questions. Is somebody going to go over some of the answers to those questions?
Chairman, Aon will go over the presentation and in hopes to answer those questions that they've raised. And if not, I'm happy to address those questions as Aon will as well.
Okay, thank you. So now we're ready for Aon if you're ready to share.
Yes, Mr. Chair. Mr. Chair, councilors, this is Dawn Montano with Aon. I do have my presentation. If you will allow me to share my screen, I can pull that up.
Joe, I'm not sure how to allow that to happen, or does she just share her content?
It is giving me an error saying the host has disabled participant screen sharing, so I'm not able to share it.
Ms. Montano, I changed you to an attendee, see if that'll let you do it.
Chairman, I think if you change it to an attendee, she will not be able to present.
All right, I've promoted her to a panelist. Let's see if that changes anything.
Okay, let me try. Are you able to hear me now?
Yes.
We can
Okay.
hear you. Are you able to share
Yeah.
your content as a panelist?
No, it's not letting me.
Councilor Beta, you do these. If I change her to host.
I'm
Well,
here.
that-
There's Joe.
Sorry, Joe. We're having trouble having Miss Montano share her content.
Okay, I will take care of that.
Thank you.
Let me reclaim host from you real quick.
Okay.
Go to share screen. Okay, let's try it out.
All right. Okay, can everybody see my screen?
Yes.
Okay. So like Berna had said, we had made some changes to the presentation based on some of the feedback that we received from prior presentations from the Finance Committee. We've changed the formatting on a little bit of it to make it easier for you to see side-by-side comparisons. So this first screen is just showing the current plan designs. In column A, it's the premium plans with the blue color. The first one in column A is all the non-union employees, the police union and the ASME union are enrolled on that plan. In column B, you can see the fire plan. And we've highlighted in red font where there are benefit differences between the two plans. So you can see on the fire plan for certain services, they do have lower co-payments or they have differences in the benefit. Column C and D is the core plan, and then column E and F is your HRA plan. A majority of your enrollment is in the premium plan, which is in columns A and B. Does anyone have any questions regarding this information? This is what has been in place for a few years now, since I think 2015, these plan designs have been in place.
What does HRA stand for?
It's a health reimbursement account. So with this plan, it has a higher deductible, but the city does provide what is called a health reimbursement arrangement or account, to where the city provides $500 for an individual and $1,000 for a family to help the member with their out-of-pocket costs. They can use those dollars to help pay for the deductible, to pay for the co-pays for that particular plan. It is a reimbursement that the member gets after they have had the claim.
Thank you.
Any other questions? Just chime in if you have a question, because I'm not able to see everybody. Okay, let's continue.
Right. So as you all are aware that, you know, we've been asked to price some different options to help control the increase that the city is facing with this renewal. So on this, we propose an option. This is a slightly different option than what has been presented in past committees. With this option, what we're showing in column C and D is the changes that would be made. It's what is different from past presentations is this is keeping fire on their current plan with some minimum changes to stay in agreement with their union collective bargaining agreements. So in column C, that would be the new premium plan that would be offered to your non-union employees, the police union employees, and the ASME union employees. We've highlighted in blue where there are benefit changes. So column C compares back to column A. You can see there was some minor changes to co-pays for primary care physician, $25, specialists going up to $40. They were $15 and $30. One improvement we're making to the plan is for virtual visits or telehealth, having no cost sharing. So that would be a free service for the employee, which is really valid right now during the current situation. A lot of healthcare is being provided in a virtual setting.
There would be a change to the hospital care. So the copay would be going up by $100 from $250 to $350. The outpatient hospital copayment would be going up $50 from $150 to $200. Urgent care would go from $30 to $40. Emergency room from $125 to $175 copayment. Mental health in a physician office, it'd be a $40 copayment. And sorry, the copay there, we've changed this multiple times. I don't know why it keeps converting back to $500, but it should be $350, matching the inpatient hospital. Acupuncture, chiro, and naturopathy, proposing a $50 copay, a combined 24 limit for those three services, breaking out massage therapy into its own category. Massage therapy currently today has a $30 copay that would go up to $50 copayment with a 6-visit limit. Physical, speech, and occupational therapy, we would add a copay of $40 and reduce the visit limit to $30, and then ambulance add a $30 copay. When we look at column D to the fire plan, the only changes that are being made, which keeps the changes in compliance with what's in the union collective bargaining agreement, is adjusting the visit limitations on the benefits under other services. So their copay for acupuncture, chiropractic care, and naturopathy will remain the same at $10, but we are changing the visit limitation to be a combined limit between those three types of services. Breaking out massage therapy to its own category, maintaining the copayment at a $10 limit, but dropping the visit limit to 6 maximum visits per plan year.
Mr. Chairman, on that, Beta.
Go ahead, Councilor Beta.
Okay, at the Finance Committee meeting, it wasn't broken out, right? Because I thought there was a lot of discussion about massage being included as part of acupuncture and chiropractor. So you're saying now it's going to be different?
So yes, before in prior presentations, they were all lumped together. We have confirmed with Cigna that with the fire plan, that acupuncture, chiropractor care, naturopathy, and massage therapy all had separate visit limits. So each one of those benefits had a 24 visit limit. That was for the fire plan only. So what we did is we decided to break them out because where the issue with use is in the massage therapy. So we decided to split out the buckets to help control some of the spend for the city and help control some of the expense.
Okay,
You are correct.
thank you, Mr. Chairman.
Thank you, Councilor Beta. Any other questions before we move on? Okay, let's continue.
Okay. On the next slide, we are presenting an option 2. And with this option 2 closely mirrors what the state of New Mexico offers to their employees. So it is a lot of changes on this benefits compared to what is being offered today. But this was one of the asks in prior meetings that we compare what it would look like if we mirrored the state of New Mexico benefits. Again, on this program, under this option, we are keeping the fire on their own separate plan to comply with their union collective bargaining agreement. We have not changed any of the co-payments, but we did change some of the visit limitations on some of the benefits. So in column C, this would be the new premium plan that is offered to non-union police and AFSCME employees. You can see there's a whole lot of blue highlighted because there are a lot of plan design changes. It does introduce a deductible to the plan. There are some co-payments for your primary care and specialist services, but you can see there's quite a few changes. One of the biggest is inpatient hospital. It would have be subject to the deductible, and then it would have a $1,250 co-payment per admission. inpatient mental health services, it would be $1,000 copayment. I'm just highlighting some of the differences, not going through each one. The biggest difference in the other services is, again, we split out massage therapy into its own bucket. But acupuncture, chiropractic, and naturopathy would have a $60 copayment for acupuncture, chiropractic, and a $65 for naturopathy with a 25 combined visit limit. The massage therapy would be a $60 copayment with 6 limits, and physical therapy, $40 copayment with 60 visit limits. Those are the most significant changes. Under this plan, it does also incorporate pharmacy changes, which would be quite different compared to your current plans. Generic would be a $6 copayment, so that would be a reduction to what members are paying today, but the preferred brand would be a 30% coinsurance with a minimum copay of $35 and a max of $95. So the member would pay no less than $35, but no more than $95 for those prescriptions that fall in that category. And then for non-preferred brand, they'd pay 40% with a minimum of $60 and a max of $130. The brands do have a deductible on top of that of $50 for the preferred brand and $100 for the non-preferred brand. The RX benefits would remain the same on the fire plan. So before I move on, wanted to see if anybody had any questions regarding this plan design.
Any questions? Don't see any. Let's continue.
So now let's, Mr. Chair and councilors of the committee, this is looking at the costs. And so this is where we took some of your feedback to make it a little bit easier to see side by side. So I want to start out on the right side of the screen. And one of the questions that keeps coming up is the medical fund. So we wanted to make sure that was addressed on here. You can see in the purple box on the upper right hand side that the current balance is 6.2 million. You know, if you recall from prior meetings, there is a forecasted deficit for the current plan year of about $2 million. So when we offset that, that leaves a balance of 4.2 million. We do need to put some monies aside for the incurred but not reported reserve, which was 1.69 million. So that leaves a balance in the medical fund of $2.5 million. And we're going to address looking at these options if we tap into that remaining balance, what that will look like. So when we look at the table on the left in the blue, column A is the 2019-2020 estimated annual costs. And in row 1, we show the annual premium. This is the total premium, projected premium. And then beginning on row 5, we show the employee share, which is collected through their payroll deductions over the course of the year. Row 8 shows the employer's contribution, and then beginning on 11 will show what the impact is if we use the fund balance to help offset some of these increases. So column B is the renewal. And if you recall, we initially presented in prior presentations, the renewal making no changes to the plan designs would be a 9.4% increase. That's a $1.8 million increase overall. Of that, the employees' contributions are projected to be 5.1 million. So that is an increase of 441,000 to the employees. On row 8, you can see the employer share of the renewal increase would be 16.7 million. So that's 1.4 million increase to the city. If we take the fund balance from the right-hand side of the screen and we offset the increase to the city, the 1.4 million, that would leave a fund balance of 1.8 million. If we also took the increase to the employees and offset to not pass on an increase in employees, we'd reduce the fund balance by an additional $441,000. So that take the fund balance down to $647,000. Column C goes through the same example, but that was looking at that option 1 where it was making some changes to some of the benefits that is offered to the non-union police and the ASME union. And then leaving the fire plan copays the same, but changing to some of the visit limits. So that option would be an overall 7.7% increase, or 1.5 million increase in total. That is a difference from the renewal of making no changes of $342,000. The impact to the employee is their contributions on an annual basis would be a little over $5 million. So an increase from what they're paying in the current plan year of $360,000, but is $80,000 less than what the renewal would come in at. Row 8 is the impact to the city share. So the city share under option 1 would be $16,448,000. That would be an increase of 1.17 million versus the 1.435 million. So it's a $262,000 savings to the city to make those plan design changes in option number 1. So if we use the fund balance to offset these increases, again, we're taking the current balance of 2.5 million, subtracting out the employer increase from row 9. That leaves a fund balance of 1.35 million. If we also offset the fund with the employee increase on row 6 of 360,000, that would leave a fund balance of $989,000. Option 2, which had the most dramatic changes to the benefit plan design, you can see it has the biggest savings to the benefits. It actually is a reduction in costs. It would be a 3.5% reduction to your current costs. So that would be a savings of over $700,000 compared to what you are paying in the 2019-2020 plan year. It would be a 2.5 million savings to where the renewal is coming in if you make no plan design changes. So the impact to the employees on row 5 is their contributions would drop to 4.4 million for the year. That's a $213,000 savings. The employer share, which is the city of Santa Fe share, would be 14.781 million. That is 492,000 less than what you are paying in the 2019-2020 plan year, or it would be a savings of 1.928 million compared to what the renewal is going up to effective 2021. Again, if we take a look at the fund balance, because this plan option is projected to come in with lower claims costs, we would not need to use the fund. If claims run as expected, we would not need to use the fund balance to offset the increase for the employer or the employees. And we could potentially be looking at putting some money back into the fund, provided claims run as expected. However, if they run higher than expected, then these numbers in the fund balance will be affected even further. So a couple of points we wanted to make off to the side here is considerations for you to think about when using the fund balance to offset the increase is you can use the fund to offset it so that way you don't have to tap into other resources, your general fund, to use to offset increased costs. However, if you deplete the fund balance, if claims come in higher than expected, then the city would have to find other resources within the general fund dollars to use to fund any shortfalls that may happen in the future plan years. And we've seen plan shortfalls for the past 2 years. If we completely deplete the fund, then at some point we would need to discuss about how do we rebuild that fund. And when we look at pricing for about every million we want to build back into the fund, we would need to project an additional 4 to 5% increase on top of the renewal increase to be able to work towards building that fund back up. So if we deplete the fund by offsetting the renewal increase or going with one of the options, in future years, if we want to work to building that fund back up to the $5 million level, or whatever level council deems as desirable, we need to factor in some margin additional increase to future renewals to do that. So I'm going to pause here and take any questions to see if this helps give you more side-by-side view of the different options and what the dollar comparisons mean.
Great, thank you, Ms. Montano. Any questions from committee members? All right, if the committee will indulge me, and also Ms. Montano, Ms. Salazar, the unions asked if they could speak. I don't know if any of them are on, but I'd like to see if any of them have comment. Give me a second to go through who's on here. I see Santa Fe firefighters on. Let me see if I can promote you.
Can you?
Firefighters, are you able to be heard? Mr. Lopez, are you on? Mr. Lopez, are you able to hear me? Can you unmute and see if you can ask a question?
Yes, sir. Can you hear us?
Yeah, did you have any questions on the presentation?
Yes, sir. We did. Thank you for giving us this time to speak to the council and speak with the presentation group, Aon. Don, I have some questions real quick about page number 5, the one that you were just kind of going over.
Yes, sir.
So my questions, I guess, is, so when it shows, when we're showing the fund balances, if we look at line item 15, row B, and it shows the 647,210, how did we get to that dollar amount?
Okay, Mr. Chair, councilors, if I may. So if we look at the purple box at the upper right.
Sure.
And we presented this at the finance committee and talked about this a little bit. The fund balance is sitting at 6.2 million. We know that at the end of this plan year, the 2019-2020 plan year, we're going to have a shortfall in the fund because claims have been running higher than expected. Right now, the shortfall is looking to be about $2 million. So the fund is going to take care of that shortfall. So we have to subtract out that $2 million from that fund. So that leaves a balance of 4.2 million. Then we need to leave for the incurred but not reported reserves. So that's what we need to leave on hand for claims that have happened but have not been presented for payment. So that's estimated at 1.698. So when we subtract that from the 4.2, that gives us a 2.54 million. So that 2.54 million carries down to row 11 of the chart on the left-hand side. Do you see that? Okay. So we take that balance, and then what we're saying here is if we use this balance to offset the increases that the employer, the city is facing, and the increases that the employees would face, so that way there would be no change to what the employees are paying today and what the city is paying today, it would deplete the fund. So that 2.54 million, if we subtract out what the increase is to the employer, so that's the increase to the employer is row 9, 1.45 million. When we subtract that out from that 2.54 million, that leaves a fund balance of $1,088,000. Then if the council decides they do not want to pass an increase in costs on to the employees, then we use this fund to offset the increase in the cost for the plan changes, which is row 6 to the employees. So in column B, that's 441,000. So that would take the balance down to 647,000 when we subtract 441 from the balance of 1.088 million. So that would be if column B, if we renew the plans as they are today, no plan changes whatsoever, but using the fund to offset the increase in costs, so that way there is no increase to the city. And if this council decided they didn't want to pass along the increase in cost and premiums to the employees and using the fund balance, it would totally, pretty much deplete the fund balance.
Sure. Okay. So my question is what's the expected total claims and fixed costs that they expect? Because if we add those numbers together, what we're going to pay to offset plus what the increase is, we're anticipating to spend almost $22 million this year on health insurance claims and fixed costs. Is that what the trend is? Is that we're going to be at over $20 million in cost this year?
Mr. Chair, councilors, yes, that is correct. So that is what's showing on row 1. So currently your total cost, your fixed costs, what you're putting aside to pay claims is what is showing in row 1. So in the 2019-2020 plan year, we're projecting that to finish out and be 19.966 million.
Okay.
With the renewal, not making any benefit design changes, that would go up to 21,843,000. If we adopted the changes in option number 1, it'd be 21,501,000. If it was adopted, the changes in option number 2, it would actually drop cost to $19,260,000. So basically, when we take those totals and split it out between the employee's share and the employer's share, which is the 76.5% is the employer's share, and that's what you see on rows 5 and 8.
Okay. My question is how much money are we expecting to go out from the fund? So historically, in the fiscal year or 18-19. The fund cost $20 million, $221,378,000 that year. That was all our fixed expenses, that were all of the claims and things like that. Are we expecting it to be, when you show the fund balance at 647,000, are we expecting it to be almost $22 to $23 million worth of claims this year, which is almost 15% higher than last year?
So what we're saying is not taking just ignore the fund balance for a minute. Yeah. Okay. So what we're saying is in 2020, 2021, if the plan does not change whatsoever, if all the co-payments, all the limits, everything stays the same, the costs we're estimating to be based on current trends, we're expecting that the total cost between fixed costs and claims would be 21,843,000.
Okay, so the annual, sorry, because I keep seeing it says annual premium. So I'm assuming that's the money coming in by the employees, not also what you're expecting the costs to be that year.
Yeah, no, this is the total cost.
So you're expecting that to be the cost, the claims coming in, money's going out, not just the premiums that are coming in from the employer.
Correct.
Okay.
So what we do is we take that 21,843,000 and split that between the employer and the employee share. So that's what you see, the employee share on row 5 and the employer share on row 8. And that's per the percentages that are in the collective bargaining agreements.
So basically, if we change the premiums at the 9.4, we should break even on the estimates. And then if the annual premium is what you expect the cost going out and the cost coming in to be 21,000. Plus we have, once we have the increase of the 1.8, wouldn't that mean the money coming in would be over the 1.8? So we would be bringing in almost 22 million? Or help me understand
So-
how the money comes in and how the money goes out. Because I look at the page on like page 10, where you guys are showing the money coming in and the money going out. And this page doesn't really reference that very well when I'm looking and trying to understand how the fund is going to be so negatively impact when we're increasing in premiums to offset the anticipated increase in claims, but then the fund balance comes down to 647.
Mr. Chair, counselors, so let's just focus on this page and let me explain it. So just comparing the renewal. So column B to column A. Column A is your current, where we're expecting the 2019-2020 plan year to end up at 19 million, just under 20 million in costs. With the renewal, we're projecting the fixed costs and the claims are gonna equal $21,843,000. So when we compare the difference of that number in column B, row 1, to where it is currently in column A, row 1, that is a difference of $1.8 million. So total costs, if we look at year over year, it's going up $1.8 million. So that's just showing you the difference here. It's not being added to anything. It's just showing that the total costs are going up $1.8 million. If we look at the employees portion on row 5, the employee share equates to currently about 4.692 million. That will go up to 5.133 million. So that, when we look year over year, that means the employees would pay $441,000 more of this share, okay? The city's cost is on row 8. They're currently at 15.274 million. With the renewal, cost is 16.710. So when we look year over year, their cost is going up 1.4 million. This 1.4 plus this 441 equals this 1.87. So overall, if we were not touching the fund balance, just ignoring that, what we're saying is in total, the city's plan is going up 1.87 million. Their costs are going up 1.87 million. The employee share is going up 441, and the employer share is going up 1.435 million. So if the city was not in a budget shortfall and they could be voting and saying, okay, we can absorb that $1.4 million and we could, they could vote and make that move on. But the problem is the city is in a budget shortfall. So where do we find this 1.4 million of increased cost to the city? It could come from the fund balance. So if we do that, that takes that fund balance down by 1.4 million. So it would leave the fund balance down at 1.08 million. If the city councilors were to vote to decide and say, hey, you know what, we don't want to pass any cost premium increase to employees, we'll use the fund balance to offset so the employees' payroll deduction costs won't go up. Then we'd pull, if that money gets pulled from the fund balance, that's where it takes it down to 400 or by 400,000, it takes it down to 647,000. Okay, does that provide clarity?
That does answer a lot of the questions that I had about those numbers. Thank you, Don.
Very good, thank you. I can't tell if there are any other unions on, so if there's somebody from AFSCME or from POA.
Mr. Chairman,
Go ahead, Ms. Martin.
can I get the two gentlemen's names from the Santa Fe Firefighters Union, please?
Mr. Lopez is the president and Mr. Martinez, I don't know if you have a title, Mr. Martinez, or
And your first
You
name,
remember.
Mr. Martinez and Mr. Lopez?
My first name's Aiden, A-D-A-N.
Oh, okay.
I'm the President of the Local 2059.
And your first name, Mr. Lopez?
Aiden,
Aiden Martinez and then Mr. Lopez. What is his first name?
no ma'am, it's Aiden Lopez and
Oh.
Matthew Martinez.
Sorry.
Okay.
Ms. Salazar, can you see if there's anybody from ASME or POA on? I don't know all the names or recognize all the faces.
Anybody here from AFSME or POA?
Yeah, I don't know if you can scroll through the list of people that are on the meeting, but
Yeah, there's not anybody that I recognize. Aiden or Matt, are you aware if they were going to be joining in?
We had talked to them and I thought they understood that the meeting was today. We didn't really haven't talked to them since Friday, so I don't know. I haven't followed up with them today or during the weekend. We're trying to get a hold of them right now. So if you guys have a few minutes, we can call them and see if they are or not.
Let's go.
well, Mr. Martinez and Mr. Lopez, thank you both for being on. That's been very helpful, and your questions have been very helpful as well. So thank you for that. Now we're on to any questions from the committee. Anybody from the committee have any questions?
Mr. Chair,
Yes.
Councilor Vihel Coppler, did you recognize me? I didn't know.
Go ahead. I didn't see that that you wanted to ask a question, but go ahead.
I was wondering, how many of these presentations are we going to get before it goes to council?
I believe this is it, right, Ms. Salazar?
Mr. Chairman, Councilor Vihel Coppler, yes, this is the last presentation and it'll go to council tomorrow night.
Okay, and are you giving a recommendation on any of this or are you doing that tomorrow? Ms. Salazar?
Chairman, Councilor Vihel Coppler, after the last discussion from Finance Committee, I think there were 3 options, so we narrowed it down to 2. Taking into consideration what the union has voiced regarding concerns of changes, I think option 2 definitely is the most cost-effective option, but it has the most significant changes. So option 1, provides for some cost savings and has minimal changes to employees. So I would say if we're concerned about the changes, my recommendation would be option 1 with the caveat that we would bring forward on a monthly basis or at least at a minimum quarterly, but perhaps monthly, how the fund is doing and entertain the idea of maybe having another change effective January 1st, possibly. If we see that our fund is in the shape that it's in right now, if we're going to be using reserve funding, because the reserve funding is really going to be depleted if we go with option 1.
So when this new presentation was sent to us and it separates the fire out, so is that going to stay that way?
Vihel Coppler, that's part of the collective bargaining agreement. So we would have to engage in negotiations with the fire union. but I believe that Don Montano has incorporated a slide here to see the cost savings if the fire union were to jump on with a regular city employee plan.
And where is that? Is that in the appendix or where?
Mr. Chairman, Councilor Hill Coppler, I think she just put it on the screen. It's page 18.
Ms. Montano, do you want to explain this page?
Sure, Mr. Chair. Councilors, thank you. So this page follows the same format as what we presented previously, but it is making the assumption in column C, option 1A, that it would move all employees to the premium plan making the changes. So the fire would be moved on to the same plan as the remainder of the employees. Option 2A would be moving the fire to the same plan that was illustrated in option 2. So you can see it takes the renewal increase to a 5.9% increase versus in column C versus the 7.7, or a savings of 4% in column D. It would be less of an increase when we break out the contributions, the share of the employees on row 5. You can see the increase by moving everybody to the one premium plan would be 274,000 increase to the employees and a 906,000 increase to the city. So it does reduce the increase amount quite a bit to both employees and the city.
So what's the timing of the negotiations? And how can we vote on, I mean, I'm assuming this page 18 is part of tomorrow's vote. So how does that work?
Chairman, Councilor Hill Coppler, the negotiations, I believe, are their contract for financial articles is currently open, but I don't know where they're at with the negotiations. So this was just to provide some information of what that salary, what that savings would look like if we had just one plan. The negotiations with the collective bargaining negotiations will not be completed to make that change, obviously, for tomorrow, but it's something that we can look at as we continue to move forward and provide the monthly updates to the fund balance, the plan, and the potential of looking at other changes effective for the new calendar year. A lot of insurance plans are on a calendar year basis. We're on a fiscal year basis. So that's another option that we can look at. Do we want to change to a calendar year basis? That would require some changes, but we could absolutely look at that. And that might give us a few more months to look at how our budget is looking as a whole. And then again, have some more months under our belt in looking at our insurance plan.
Okay, well, so, and I understand the unions asked for an executive performance report from Cigna, which provides an annual report of healthcare performance. Was that provided, and can we see that?
Chairman, Councilor Hill Coppler, the report that was provided back to the council in February regarding the performance was also provided to the union. Cigna has since provided some other information that was, I think, a little more historical, and we can work with them to provide the more updated information after February, but they did receive the information that you all received in February.
You mean updated information as of next February? Is that what you're saying?
Mr. Chairman, Councilor Hill Coppler, no, as of February of 2020.
And so that's the report we got? Is that what you said?
Yes.
So I guess we got it by email, and I'll look for it. Okay. I know I had another question. Well, I'll pass and I'll think of my question. I lost it. Thank you.
Counselor Beta, you have your virtual hand up.
Thank you, Mr. Chairman. The slide regarding premiums, can we go back to that for a second? Okay, thank you. The concern I have is with premiums and I'm sorry, with co-payments for like physical therapy, occupational therapy, and speech. I have a concern with the proposed increase for those co-payments, especially for speech, physical therapy. I know there's been an increase over the years, especially with children being referred to physical therapy for speech issues. And I think I saw something where one of the proposals is for that co-payment to go up to $60. Did I see that correctly? Or $40?
Mr. Chairman, Councilor Abeyta, I think Don just changed the slide to 3. And so we're looking at row 16. So it would be, right, it would be an increase to $40 per visit with a 30 visit limit would be.
And what is the copay right now?
There's no copayment right now.
Okay, so when would be the time for us to say we want a $20 copayment instead of 40? Is that tomorrow when we hear this?
Mr. Chairman, Councilor Abeyta, I would recommend that if you're looking for some sort of a change, that we get that information now so we have the rest of tonight and tomorrow morning to recalculate before it comes to the governing body tomorrow, if that's something that you would like to see what that costing would look like.
Okay, so can I just email you that between like this evening or tomorrow? I think that 40 is kind of high, especially like I said, for families, but so I guess I'll just email you maybe $20 or 10 something.
Any other questions, Counselor Beta?
No, that's it for now. Thank you, Chairman.
Counselor Lindell.
Thank you, Chair. Can we go back to the slide? I think it's on page 18. That's it. This is kind of a risky path that we're looking to travel here. We have a current balance of 6.2 million. We went over this some years ago. I know that Councilor Rivera was there. We asked to increase our reserves at that point in time. What we're looking at with certainly 2 of these plans is exhausting our reserves. I know that the numbers are based on what we think we're going to pay in the next year. They've gone up. Not only have our claims gone up, our costs go up every year. The problem being that when you look at column B here on the 2021 renewal, if everything goes according to plan and everything works out, we'll have a fund balance of about $650,000. We only need 1 or 2 major claims to eat up that amount of money, and we have zero fund balance. And we're kicking the can down the road because in order to build that fund balance up in the future, it's going to take much bigger costs than it is now. I think this is risky, and we could easily deplete that entire fund balance of 650. For that matter, look at this year's numbers. We could easily deplete the fund balance of column C of 1.3 million. These are not good choices that we have right now. But I think that this council can be realistic about it, or we can kick the can down the road and we'll end up with a zero fund balance, and rebuilding that's going to be very, very painful. So those are my comments, Chair.
Thank you, Councillor Lindell. Councillor Garcia.
Thank you, Mr. Chair. So in the past, there was three options, and tonight we're presented with two. And I would like to see a blending of 1 and 2, because as Councillor Lindell stated, option 1 kind of leaves our reserves more depleted, whereas option 2, we save a lot more money, but we are drastically going to increase costs for our employees, which I do not want to do. When you're looking at the co-pays, I mean, some of them triple. When you're looking at, to Councillor Abeta's point, if we can go back to the co-pays for speech therapy, I mean, it's drastically higher than $40 and what we would see in option 1. So with that, is there a way we can blend between option 1 and option 2 and have a option 1.5 where we can begin to save more money, but not necessarily have a great increase on the costs of healthcare for our employees? You know, when you see co-pays go up, let's go to option 2, slide 3. You see co-pays go up triple for your primary care, basically, and to me, I think we need to go back and look how we can not put so much cost savings and hit the employee's pocket and the out of pocket. I know there was the comment made, if we take option 2, we'll save $213 up front, but on the back end, how much more is that going to cost employees as they pay out of pocket? I guarantee that's going to be a lot more than those savings. So I wish we had a blending of both. And I guess to Bernadette, how do we do that? I mean, given this is up for council tomorrow, how come we went from 3 options to 2 options when I think there is need to be 3 options, not an extreme and not but I wouldn't call it lenient either, but I would think option 2 is a very extreme move for us.
And Councillor Garcia, after all the feedback, this is a very complex process in dealing with the different plans, the collective bargaining, and trying to figure out the best solution moving forward. When we presented to the Finance Committee a couple of weeks ago, one of the options was essentially a combination or a hybrid of option 1 and option 2. And after discussion with the union leadership, you know, that was not something that they were amenable to. And so we were trying to come up with other solutions to help reduce that liability that the city has, while lessening the impact to employees, and then providing a mechanism where we can review the fund, meet with the insurance committee committee on a monthly basis, and then provide council with reports at a minimum quarterly. So like I say, it is a very complex process, and one of the options submitted to the finance committee was essentially what you're asking for. And so after much discussion and costing scenarios, we came with the two options here that you have in front of you today.
Okay, and so question I have, should option 2 be recommended? Is there an estimation or any thoughts to how many folks might leave the city's insurance plan and how it might affect numbers, given that they might have a spouse that has a better insurance plan through their employer and employees then drop the city insurance?
There would be no way for us to know those numbers because we don't know, what someone's family situation is and, what the insurance plans of their spouses or domestic partners look like. So that would be a hard number to gauge.
Okay. Those are the only questions I have, Mr. Chair. Thank you.
Thank you, Councillor. Councillor Vihel Coppler.
Thank you, Mr. Chair. I'm concerned about having, having a lot of these hit the employees after we just hit them. And also, there's no telling for next year what's going to happen. And maybe these costs will lessen if we don't have there's many employees. I'm not sure. But I agree with Councillor Garcia that we ought to come up with a little more gentler plan. And, I know this is hard, but on the other hand, we still don't know for sure what's going to happen. So, I think that the employees should bear some increases, but I think some of these are rather steep. And that's what I'd like HR and Aon to look at. I don't think we've really explored all the avenues. And so I'd like to see a little bit lessening of the pain. The next question I had is, what are the costs, and I haven't seen that anywhere, that we're being increased for the services of Aon and Cigna? What are those costs?
Chairman, Councillor Vihel Coppler, the Aon contract is not in the same time frame as the Cigna contract. The Cigna contract that you just approved about a month ago, the administrative fees went up 100, I believe it was 110,000. And that was primarily the increase to stop loss insurance. And that was because, of the claims, and the stop loss insurance did go up. I think it was to the tune of about 9%. As I mentioned in previous presentations, and I think Mr. Burley has also mentioned that the renewals for stop loss on the market are in the double digits, about 20%. So we feel like the city got a pretty good rate with the stop loss rate that we got from Cigna. Back to your first question about what you would like HR and Aon to
Before you
review.
move on, can you tell us what we're paying Aon?
Off the top of my head, I want to say it's about 60,000 annually, maybe less, but it's definitely under 100, well below 100.
Okay.
And that's, yeah. So if we go back to your what you would like HR and Aon to look at, I'd like to point out real quick where Don is on slide 5, the increases to the copays that Don has presented earlier are really the increases, the only increases being recommended with option 1. The premium rate increases for employees under this scenario of column C are being absorbed by the fund balance. So the increases on a biweekly basis for employees would be absorbed by the fund balance. And so really the only changes to the employees would be the co-pays on a previous slide, and that's it. So that's why the fund balance would be reduced down under option 1 to under $1 million, because we'd be pushing the employee contribution increase towards the fund balance.
Okay, but there could still be some wiggle room on the co-pays, as Councilor Abeyta mentioned, because sometimes we don't really know if those medical services are going to be used by an employee, but it might not make a real difference if we did lower the co-pays. I mean, in some services, because we don't know if they're going to use them. So I don't think that's as risky, and I think that's better. The other comment I have more is, it's real hard to make this decision because we don't have options. I really feel like the city's kind of being held hostage a bit because we didn't go out to bid. And I know you said in one of the prior meetings that you didn't have time, or you didn't have people, or I don't know what, you said something like that, but the fact remains we didn't go out to bid. And when you don't go out to bid, you don't have choices and you don't have comparisons. And I think that's risky. I mean, that's the riskiest thing of all. And, especially in these times, I think, I would imagine insurance companies are also kind of losing some money. But nevertheless, when you don't have options, you don't have choices. And right now we only have one choice, and that's the choice we've been with for all these years. And where's the competition? Competition, I think, drives costs down. I could be wrong, but hopefully, there might be some increases, but I think we would have more to look at and compare with different companies. And so I'm disappointed in that, I'm disappointed that we only have the same companies bidding for our attention, which is why I asked, what are we paying them? But be that as it may, it's what we've got. But I just want you to know that I hope that this is a priority going out to bid next time. I think it's it has to be a priority because we're just looking at the same things. So that's all. Thank you, Mr. Chair.
Mr. Chairman, Councilor Vigil-Koppler, just to address your concerns, pursuant to the email that I sent you, we did not go out for RFP, and really, I will address the whole stop loss insurance again, because it's really, if we would have went out for RFP based on our claims, because we're a self-insured plan, and I don't know if Todd Burley is still on the line, but it's really based on the claims. And if we look at the market of the stop loss, which is really what drove up the cost of the administrative fees for Cigna, they were in the double digits when you look at the market value. So I hear what you're saying, and but they do also look at our claims. And if you look at our claims over the course of the last 3 years, they've been pretty high, and that's why we're in the situation that we're in right now. So I do hear what you're saying, and we will continue to work through this and provide more frequent reports to you so you can see the changes as we progress through the months.
Mr. Chair.
If I could respond to that, Bernadette. We may very well have been looking at the same data if Cigna and Aon had reapplied, or I don't know how you bid for this, but Cigna for sure. And hopefully they would have, submitted a a proposal as well. But we would have had choices. And been able to see the experience. I mean, you're saying stop loss increases, but we didn't see that. I mean, I don't know, maybe you sent it, but I didn't see those increases to know what's happening around the country. But the fact remains, we compete in a way against ourselves because we are self-insured. So I'm just saying it, not that you're wrong or anything like that, but it would have been nice to have comparisons more than just what we're seeing today, option 1, 2, 3, or whatever. We could have had a review, or not maybe us, but the people who decide on the RFPs, the committee, the options. We could have had more information. So again, I'm hoping we get to that point in the future. So thank you.
Thank you, Councillor. I understand Mr. Gilbert Baca from AFSCME is on, so I'm going to give him a couple minutes and then I'll end this discussion with a comment myself and then we'll move on. So Mr. Baca, welcome. Please take a couple minutes to identify yourself and make any comments.
Chair, this is Chris Armijo. Can you hear me, sir?
Oh, thank you, Chris. Appreciate it.
Okay, sorry about that. We kind of had to come in the side door here to speak, but I do have Gilbert Baca with me. I have Gilbert Martinez with me, and we're sitting here at the union office, and we had a couple grave concerns. First of all, I know that your HR director is saying that they have been bargaining with us. We feel that we really haven't had an opportunity to speak on this. Matter of fact, this presentation that's been given to you this evening was given to us 15 minutes before this meeting started. Hardly any time for us to sit down and review the changes, which are substantial from the last plan that we saw. We've been working collaboratively with police and fire, and I do appreciate our brothers out there, our union brothers. But there again, we feel, and I'm not here to complain, I'm just saying that we're not getting dealt a fair hand. This seems more like the furlough situation, which is pretty much ramrodded down our throats. And we weren't real happy with that as well. And we do appreciate the counselors that stood with us and try to get this table. We'd like to see if possibly the council would consider tabling this issue, mainly because of the situation that there are probably better options out there. We've offered a couple better options. Using Councilor Garcia term that something about blending of both, or even Councilor Copperby Hill, where she mentioned something a little bit more tender, if you will, something along that line. Please correct me if I'm wrong. We still believe there's room for negotiation in getting this done. Right now, for the city to consider harming or going after our health benefits in the midst of a COVID-19 pandemic, a worldwide pandemic, we feel it's dangerous. We believe that we can work collectively and try and come up with an alternative where we can make it a lot safer, a lot easier for our people. I know this has been referred to as a Cadillac plan. The only other Cadillac I know is a hearse, so we don't want to have to deal with that issue whatsoever. We've been very blessed here in New Mexico that we haven't been hit as hard as other parts of the country, but right now there's a resurgence going on. And then there's also some long-lasting effects from COVID-19 that are affecting children, whether it's a skin ailment or brain development. There's other issues that are coming up that are far-ranging. We still do not have a vaccine for this COVID-19. And we just feel that given the opportunity to get back to the table and to try and find a reasonable solution, we're not oblivious to the fact that the city is in economic downturn. I mean, we witnessed that with the furloughs that took effect 2-3 weeks ago and how it's affected our people. And we're just really concerned. And we had a really good education tonight on Don's presentation. It's given us something to look at, something to think at, maybe something that we can get back with the city. And just cut this short, I just want to thank you all for listening to us this evening and for allowing us this opportunity to see what we can do to try and work on a solution that's going to be for the betterment not only of the city employees, your constituents, but also for the community as a whole, because we know this affects everyone and we're all in it together. So once again, thank you so much, Chair. I appreciate the moment you allowed us here to speak, and we hope that we'll be able to have an opportunity to speak with you all tomorrow. Right now, we understand that the city, in order to, if they kept the current plan, they're looking at the proverbial robbing Peter to pay Paul from that fund to cover or upshore their portion of funding the current pension. But we believe that we can really sit down, we can come to an agreement and present something to the city council that I think everyone would be agreeable to. We may not all walk away happy, but at least we'll walk away knowing that we were able to work collectively together. Thank you, sir.
Thank you, Mr. Armijo. Ms. Salazar, if we were to take option one, which is clearly less of a blow than option two to the employees, would that buy us a year then to have more frequent communication with the unions, the council, anybody else to sort of keep us updated on a monthly basis on what's going on?
Yes, that would allow us more time to review the plan and look at what the plan is doing on a monthly basis. Also, if you look at the changes for option one, it's still a significantly more generous plan than other plans that local and state employees receive throughout the state of New Mexico. So if you go back to, I think it's in the appendix, Dawn, I don't know if you could get to that slide. Even with the changes that we're proposing on option one, again, would still make our plan more generous in hopes that, it would be less of an impact to our employees. And so certainly we wouldn't be reducing any services, just adding the co-payments.
Right, so with everything, thank you, Ms. Salazar. So with everything I've heard tonight, option one seems to have the least amount of impact to the employees right away. And I think with the upcoming budget discussions, employees may be hit pretty hard. So I think softening the blow of insurance might be the best option at this time. The other thing is that it buys us time in order to have those deeper and harder discussions with unions, with the council to keep us updated on a monthly basis as to what's going on. I think option one with Councilor Beta's recommendation to me is not the ideal situation, but it's probably the best in light of everything going on. So that's a plan that I would support at this time. I don't think we can stay where we're at, and I think option two is too aggressive at this point. So that's my take on it. We've had a lot of discussion on this, so I think we're ready to move on. Clearly, we'll all see this tomorrow night at the council meeting, and at that point, we'll have to make a decision on where we're going. But that's my take on it. So, one last plea for any counselors or any other comment from the committee. Very good. Thank you. Thank you, Ms. Salazar. Thank you to Ms. Montano from Aon for the presentation. And we will move on now to item 9, which is a presentation and recommendation on capital project prioritization recommendations. John?
Hello, Mr. Chair, councilors. Thank you very much. We've fine-tuned the capital project list that I presented a couple of committee meetings ago, and I wanted to show you what we've come up with. We'll bring it forward after this point in an official form, so that way you guys have it in advance to look at it, but I just wanted to go over some highlights of what we've done. I'm going to share my screen real quick and just go over those. So this is the same list that I went over with you guys before. I can go over it one by one if you guys would like, but what I was gonna do for now is just highlight some of the additions and changes that we made. We were trying to scrape the bottom of the barrel here. So we initially showed you these darker orange projects, which are our 2018 GRT fund, bond, 2018 bond projects funded through our CIP GRT. We also had some remnant older GRT bond projects in this light orange. So we added those, and we added what those savings would be. It's a small amount, but it does help out. Let me get to the project savings. Okay, here we go. So other than that, one of the main changes that we made was the fire station number 2. Right now, the fire station had roughly, and I apologize, I didn't change this one either. Excuse me. So fire station 2, the bids came in, I think roughly $1.5 million over what money we have. So because of that, and because of the fact that building a new fire station would require new staff funded by the general fund, so new operating costs, we thought that it would be a good idea to hold on for a moment before we move forward with that project. Maybe looking out to an outer year bond in the next couple of years, if that is possible. Our fire chief we've been in close contact with our fire chief. He is going to be coordinating and communicating with the county to determine coverage and how that looks. When I bring this back to you in its official form, we're going to look to have a report of how that coverage is going to look. But our fire chief believes that we can, with coordination with the county, provide coverage to that area. The 2 areas, what that project savings brings up is the $6 million from the fire station. And it actually brings up roughly about $1 million from this public savings. And I didn't put it on the spreadsheet, I apologize. But I will put that on before it comes to you in your final form. So with that, this bottom line gets close to $8 million of projected capital savings, which again, we are looking to repurpose for capitalizable expenses that we normally try to absorb in our operating budgets, reducing what we pull from our general fund and GRT related revenues. Another change that we made is for Swan Park. The initial budget for Swan Park was almost $600,000, $599,000. And what that was going to get us was really only a design for a bunch of things, no construction, only design. So we decided to pull that back a bit. And right now we're proposing a budget of $349,000, saving $250,000. What this will accomplish is it's gonna get us it's gonna allow us to not only design, but construct some of the smaller things like horseshoe pits, screening. We're gonna look to put up some concrete wall barrier, some jersey barrier around the perimeter to control ATV access, things of that nature, dog park. But what is being omitted are some big ticket items such as the concession stand bathroom facility, the second access road, things that are quite a bit expensive and we didn't have enough money to build right now as it is. So we're proposing that savings. Now this savings, this is related to general obligation bond money. So it's not as easy to spend. The way that the bond question went out to the voters is it was X amount of dollars for parks and trails. So this money can only be diverted to another park or trail project. So what we're looking to do for now is move that to the MRC. And it can do one or two things for us at the MRC. Right now, if I can, I'm gonna scroll down on, this is the last change. Here's the MRC, and we have it in this gray area because it's a mixture of funding, but it has grant funding, so we put it in here. Again, the original budget of the MRC was $1.25 million. And it was comprised of $250,000 of legislative money, $500,000 of county, and $500,000 of city. We don't know the status of the legislative funding. We're hoping that we still can maintain that. But in any event, this 250 can replace that revenue loss. So for the time being, our budget for this jumps up from 1.25 million to 1.5 million. And then what we're looking to do is do a few turf-related projects, irrigation systems, stuff like that. If we have any leftover money, this will be at a later point in time. We can use that to help supplement our operating costs, and it would probably be for the following fiscal year. But again, for now, we're looking to divert the 250 from Swan Park to MRC, which would primarily go towards the Soccer Valley. It's a quick presentation. That's all I have ready for now. But again, next committee meeting, I'm looking to bring an official item with a memo with recommendations for reappropriation. And I haven't talked to finance about this, and so I'll have better direction at the next point in time. But what I was thinking we do is we maybe do it in a couple of steps. Right now, we get approval to reappropriate and de-appropriate projects as I showed. And then once finance presents their operating budget, the city's operating budget, we'll show what you guys all approved as far as de-appropriating as a revenue stream for that operating budget. I'll have a better idea of that. I'll communicate with finance between now and then and let you guys know if that's the way we're moving forward.
Thanks, John. Councilor Viejo Coppler, you have a question?
Yes, thank you, Mr. Chair. John, I just want to have you clarify that the changes you just went over on this spreadsheet are the only changes you made from when we saw this last time?
Yes, the light orange, Fire Station 2, because we're waiting for the bids, and then MRC.
Okay, and then I guess since this is kind of a living document and you're gonna revise it, we're not gonna get a copy of this right now, right? You're gonna come with a more refined and final copy, is that right?
There'll be a final version that comes to you guys in the packet with the memo, and you guys could just look through it and and fabricate any questions you guys have for me at that committee meeting.
Okay, well, thank you very much for this. It's very helpful.
Thank you, Councilor. Any other questions? Thank you, John. So again, I support you coming with a memo next meeting. I think we need to start the cutting process before the finance committee starts its budget discussions, and whatever we can do to try to decrease that 100 million deficit that we're going to have and have a balanced budget, I think is important. So appreciate all the work you're doing. Any other questions from committee members? See none, so thank you with that. Next round of matters from staff. Anything from Mr. Romero? John, any matters from staff?
No, I have no matters at this time, Chair.
Mr. Jones?
There are no matters from staff, Chair. Thank you.
Matters from the committee. Councilor Viejo Coppler.
Thank you, Mr. Chair. Two things I wanted to pass along to John. I spoke with Regina this morning, but definitely wanted to talk with you and express my sincere appreciation to the Public Works employees who helped, along with the firefighters, hang the banners, the veterans banners. They were up early and they just did a marvelous job. And I just really want you to please pass that on. And when we get back into the council chambers, I expect to have a presentation to make it more formal and thank them more widely and give them the recognition they deserve. So thank you very much, and please pass it on to them. And then,
Thank you very much.
yeah, and then the second thing is, if you all haven't driven down Cerrillos Road from Airport Road to Rodeo Road, where the mall is, that intersection, all the way to I-25, and then turn around at that stoplight way at the end, look at those banners and then come back and look at the others on the other side of Cerrillos Road. It is remarkable. It is just the most wonderful thing. And Chris, I saw your Facebook post with your father. Very nice to honor him, and anyone else who has relatives that have a banner up there. I'm just so proud of everyone for doing this, and to our city for having these, because again, we're the only one in New Mexico that's done this. We've got a lot of press, a lot of TV, a lot of interest in this. It just continues to grow, and it's just something that in these times you drive down there and it just makes your heart smile and melt. So thanks again. Thanks, John.
Thank you, Councilor Viejo Coppler. Anything from Councilor Garcia?
No, not tonight, Chair. But thank
Okay.
you.
Anything from Councilor Lindell?
She's waving her head no, Chair.
Okay, I can't see everybody. Councilor Beta?
No, I'm good. Thank you, Mr. Chairman.
All right, thank you. Matters from the chair, I'd like to echo what Councilor Viejo Coppler said is, John, if you can just thank the crews from Fire Department and Public Works that put those up. It does look amazing. They put flags above each veteran's poster, which just added a sense of pride that our community has for all our veterans. So it looks beautiful. I would support, this project expanding even next year. I'm getting calls from people on a daily basis that are saying we want to get our father, our grandfather up there and honored in the same way, and we're already running out of space. And it looks tremendous. So if you haven't had a chance to look at it, like Councilor Viejo Coppler said, take a drive, look at it, check it out. It's an amazing thing to see. So thank you for that. And then I wanted to thank the Public Works Committee, John, for, we're going to have to make some tough decisions, and you've already started that process. So thank you for that. Bernadette, the insurance discussion, I know it was lengthy tonight, but very much necessary. Hopefully it'll decrease the amount of discussion we have tomorrow night. Maybe not, but it's an important thing for all our employees. So I think option one, which softens the blow, is a pretty decent scenario to go with, but does buy some time and doesn't have such a big punch on the employees. So with that, our next meeting is Monday, June 8th, 2020. Unless there's anything else, we are adjourned. Thank you all very much. Thank you, Ms. Martin, as well. You're on mute, but I think you said thanks, so.
Thank you very much, sir. I appreciate that.
You're welcome, and you be safe and take care.
You too, Counselor.
Bye-bye.
Bye.